Okay, this morning I'm going to be administering an ear or Otic medication for a Mr. Carl Johnson. I'm going to start off with my my 3 medication checks, of course, throughout this, while also keeping in mind the 5 medication rights. So first off, I'm going to want to make sure that I have either an EMAR pulled up or a paper MAR. In this case, I have the paper MAR. So for Mr. Carl Johnson, I'm going to make sure that there is an order standing for the eardrops first, through the provider or the supervising nurse right now. And then I'm going to go ahead and make sure that it is in fact on the MAR. So it is the benzoic Otic drops. So this one is going to be 2 drops in the right ear twice daily for a week. And then I'm going to make sure that on here it has the Carl Johnson, his name is on here, his date of birth is on here, and it is correct, as well as any allergies, and he is allergic to penicillin, acetaminophen, and then we're just going to go ahead and make sure that it all lines up with the patient once we enter the patient's room. So I'm going to go ahead and identify myself to the patient. Good morning, Mr. Johnson. My name is Katrina. I'll be your TMA this morning. I have some eye drops to administer for you this morning. I'm going to go ahead and provide my hand hygiene, wash my hands, hand sanitizer, make sure that's all good. And then I'm going to go and explain the procedure to the resident and do a face-to-face with Mr. Johnson. Okay. Good morning, Mr. Johnson. I'm Katrina, your TMA this morning. I'm going to be administering some eardrops for you. And then I'm going to prepare him for it and answer any questions he had about why he's getting them. Yeah, I'm going to go ahead, provide privacy, close the door, close the curtain, and I'm going to put on my gloves. And then once I have my gloves on, I'm going to position Mr. Johnson in a position of comfort, but also on his side. That way we can properly administer the eardrops. So we're going to administer him. We're just gonna have him lay on his side like so. That way his ear is exposed and the drops can get in there. All right, and then along with checking in my MAR and the medication checks, I'm just gonna make sure that the labels are correct on here. Making sure it says ear drops and not eye drops. The patient's name and date of birth are going to match up with the MAR, as well as what was the information I gathered for the patient. So I'm going to, he has his head tilted back, he's laying on his side, and then I'm going to take a cotton ball and get any debris or excess moisture out of the ear before administering the eye drops. So here is my cotton ball, and just gently dab and make sure it's all clear. Okay, the ear is clear and ready to receive the eardrops. Then I'm going to straighten out his ear canal, and I'm going to administer the correct amount of drops, which according to the MAR is 2 drops currently. He gets it twice a day, but I'm only going to administer 2 because this is the first time he's getting it today. And I'm just going to make sure that the liquid's going to be able to run down into the side of the ear canal. And then once that's over, I'm going to place the cotton ball over the ear canal. Make sure it's not in the ear canal because you don't want it to absorb all of it, but you also don't want the medication to run off. And then I'm going to make sure that it's just in one ear and not both of them. And it says just one, so the right ear. Okay. So we're going to take the top off, and we have a clean cotton ball. We're going to go ahead and administer the eardrops. So he's on his side. The ear's been cleaned. I'm going to put 1 drop in the canal and 2 drops in the canal. Make sure that they're both in there, in the canal. And then I'm just going to place this here and let that stay. Okay. Then I'm going to have him stay in the position for 3 to 5 minutes just to make sure that the eardrops do their job and that they're able to absorb into the ear canal properly for his treatment. I'm going to make sure he's comfortable in that position for the 3 to 5 minutes before I leave him. I'm also going to provide his call lights so he can call me if there's any discomfort. And then I can then exit the room. And then I'm going to make sure to properly store these, put the cap back on, and make sure it's tight, but not too tight so the next provider can administer them, and then store them in the proper space. Then I'm also going to go back to the MAR, and I'm going to check off the underneath the eardrops. Under the 8 a.m. slot, I'm going to write they were administered at 8 a.m. and I'm going to initial that. And at the bottom, I'm also going to make sure that I sign my full name and initial next to my name. That way people can identify that it was me who gave the eardrops at 8 a.m. this morning for the first time. And I'm going to make sure that if there's any changes, any discomfort, pain, or allergic reactions from this eardrop administration, I'll report those to the nurse in charge. Then again, just making sure that you did your 3 medication checks, following your 5 rights of medications, and properly making sure you documented in the MAR.